Hey y'all, it's Lisa Fujioka and Dr. Eugene Kim here on another episode of The House Call, the podcast where everyday people talk to doctors and different healthcare professionals to break down complex yet vital health information into plain English so we can all understand. Now, in our Diet Sucks series, we've been talking a lot about how every individual is so unique. Our metabolism, our reactions to different diet and exercises, and our reactions even to a lot of interventions like medications. It's just, there's no one-size-fits-all solution. Today, we're going to dive deep into yet another approach to weight management and overall health that is so meaningful and thoughtful: naturopathic medicine. And naturopathic medicine, in a nutshell, is a holistic form of healthcare that focuses on the entire person and their causes and not just the symptom at hand that we're so used to from conventional medicine.
And so today we're joined by Dr. Marta Keith to learn about the science behind this approach and how you can use it to improve your health and specifically weight management. We're very lucky to have her today. Dr. Marta Keith is a licensed naturopathic doctor and a graduate of North America's oldest accredited naturopathic university, the National University of Natural Medicine in Portland, Oregon. Dr. Keith also specializes in the areas of gut health, mental health, sleep disorders, chronic pain, autoimmunity, and gender-affirming care. Currently, she leads the obesity clinic here at the Lavender Clinic in Honolulu, a nonprofit healthcare center that focuses on providing inclusive, quality healthcare for all communities, particularly the LGBTQ community. Welcome, Dr. Keith.
Oh, thanks for having me. It's a real pleasure, Eugene.
Dr. Keith, so excited to have you. Thanks for your time today.
Thanks.
Now, when I first heard about naturopathic medicine and what a naturopathic doctor was, Eugene had to break it down for me into the very basics. It's so thoughtful and so important. And I personally gravitated towards it so much when I started learning more about it. But I bet you majority of our listeners today have not heard about it, and this may be their first time. Can you give us a high-level explanation of what it is?
I don't know about high level, but I will give you the explanation that I think maybe people can help understand it a little bit better. I would say that naturopathic medicine is a holistic approach to healthcare. It's kind of like old school shamanism, if you will, but revived and modernized so that we can also treat people in this modern era that we live in. So it's the naturopathic school that I went to. It's an accredited university, a 4-year program, just like you'd get for an MD or a DO. The difference really in the training is that we get a lot more emphasis on prevention, chronic disease management, and I think nutrition and the behavioral and lifestyle changes that people can really harness to empower themselves to take control of their health. Whereas I think what's different, everything, it's always trade-offs, right? Where it's like there's no perfect solutions in life, there's just trade-offs. And so we get extra training in the prevention and the behavioral and lifestyle things like this at the expense of not getting any hospital rotations. So when people are inpatient, we're definitely out of our scope at that point. And if you're in a car accident or something, please then go to the hospital, go see the emergency room. Like, do not come see a naturopath if you're acutely injured in that way. If, however, you've had things going on, like you're fatigued and you don't know why, you're struggling with your weight and you don't know why, or maybe you have a chronic condition like high blood pressure or high cholesterol, like a lot of folks do, or even overweight or obesity, which are just so common nowadays that more people have them than don't, interestingly enough. I think this is where naturopathic medicine can really shine. And it's not necessarily that it's a separate system unto itself and the patient should only seek that route. I think it's something that should be integrated into the conventional medical model so that we get a holistic approach and we bring the nature back to medicine. We have gotten ourselves locked into these institutions in a way, and we're doing medicine and it's become so commoditized, if you will, like the cafeteria version of medicine, and we need to get back to our roots. One other thing that I would say about naturopathic medicine is that it's nature's medicine. It belongs to all of us. It is a gift from nature. From Mother Nature has gifted this medicine to us. And these are hard-won wisdoms that our ancestors learned. And they have learned these things around the globe about what it means to be a happy, healthy, high-functioning human. And they have passed these wisdoms down along the ages. And so I think naturopathic medicine is a medicine that keeps those things in mind and doesn't throw out the baby with the bathwater in terms of trying to bring science into medicine now. One thing I think too, though, it's funny. I can't tell you how many people, will ask me. It's like, oh, naturopathic medicine, that's like crystals, right? And I'm just like, no, that's just, maybe some naturopaths are doing that, but I think that just really misses the point. The university that I attended really the purpose was to graduate candidates or graduate doctors who understood the standard of care for conventional medicine and could meet that standard of care, and then also just bring the naturopathic element to layer that on top of it and weave it throughout. And so I think that's important to realize.
So there's a lot of parts to what you said that I want to dive deep into. And the first part is, it's a holistic approach and you look at the whole person and not just individual independent symptom by symptom and just diagnose and kind of treat that. So what does that process look like? I mean, do you have a certain checklist and you think about, okay, metabolic health versus cardiovascular health? Like, are there certain major components that you look at?
Yeah, I would say that I look at all of it, and at the risk of once in a while overwhelming myself if someone has a lot going on, to be honest. But I think one of the problems, if you will, with the conventional medical model and why it has left a lot of people dissatisfied and seeking adjunctive care elsewhere, like in terms of complementary and alternative health, is that it's so siloed that we wind up, we risk missing the forest for the trees, right? Like if we're only looking at someone's heart, or we're only looking at their metabolic health, we're only looking at their mental health, or any of these other things, then we're not looking at the whole person. And naturopathic medicine does a really good job of zooming way back out and saying like, hey, there's a whole person here, and we need to be taking the whole is the sum of the parts, and yet the whole is bigger than like I've heard there's some sort of model, I don't remember what it is. Eugene, maybe you know and could help me out here, but there's some sort of model where it's like the sum, all of the individual parts create a sum that is somehow bigger, greater, grander than just the value of each individual component. And so there's something lost when we break it down into this overly reductionistic approach. And I think we have to bring it back into this comprehensive, innovative approach where we're looking at the whole person. And we also have to remember the mind-body connection and think about mental health and physical health being intimately and inextricably interwoven. These things have to be taken together. And so I think just like we have, we check vitals in conventional medicine and also in naturopathic medicine, medical vitals, but I think we should also be doing behavioral health vitals, like mental health vitals, like how are you doing today? Is there something, that you need us to know urgently to help you? Like, is there something going on that might not have anything to do with your blood pressure or your pulse oximeter, but that has to do with how you're functioning or not, and where you really need the support. Maybe the acuity is something that we can't see and measure.
We are so siloed in our body systems. Coming from a hospital-based physician for over 10, 15 years, you see it every day. The cardiologist comes by and just talks about the heart. The GI doctor comes by and just talks about the GI system. The lung doctor just comes by and talks about, the lungs, instead of forgetting that the human being is a whole system and they all work in conjunction together, and getting back to the roots of that. And what I love what you said about patient empowerment too, is that, admittedly, as an MD, we are so focused on the disease process that we forget to come back to think about the person as a whole being and the root etiology of where this is all coming from, and especially the mental component and how we are mind, body, and soul. I love to say we are equal parts mind, body, and soul, right? And we are too focused, I think, in modern medicine on just the body component and taking vital signs instead of thinking about this huge other component, which is equally and more important, in my opinion.
There are tenets of naturopathic medicine, and one of them is doctor as teacher. And so we really want to empower our patients with the education they need to take care of themselves. And I think that we all know, even in conventional medicine, that locus of control is a huge lever that can be pushed. And the more that we can increase internal locus of control for patients, and at the end of each visit, return locus of control to the patient, then we make the patient the most important member of their healthcare team. And so, like, the part of the reason that I chose NUNM to go to school was that they were a patient-centered primary care home. And that meant something to me. It was like, it's a patient-centered, patient-first approach. It's like a poll campaign for health. It's like we want to tell people, and dictate to them, like, here are all the things that you need for good health. Whereas the patient-centered approach says, like, what would you like to do for good health? What does good health look like to you? And what would work for your life? And it really centers the patient in that discussion. And so I think that fits with my personality and my approach to medicine, which takes this motivational interviewing approach. Like, well, why do you want good health? And then if you want good health, and people say, well, because I want to be happy and I want to be healthy. And it's like, well, what would that look like though? If we break those down into components, like, how would you know when you're happy? Like, what would need to happen in your life for you to have that outcome, happiness? Or like, how would you define health for yourself? And what would you need to be measuring or marking or tracking or changing to have better health for yourself as you define it? And so the thing that I think in conventional medicine, where we're risking at this point alienating folks, is by dictating downwards and having this top-down approach. And it's because it's become so siloed, and we're in such a hurry, and we're just trying to get the info we need to solve the problem that's right in front of our face, and like the one problem we have maybe time to sort of address in that visit. We want to help people rediscover their own values and their own things that bring them joy and happiness, and their own um, help them blaze the trail to health themselves. It's something that it's a hero's journey. So like when it comes to education and empowerment, I think for those of us who have like struggled with our health, a lot of us have been called to healthcare, or we've known someone who struggled with their health. So we wind up seeking out, becoming healthcare providers ourselves. And so, part of naturopathic medicine is like physician heal thyself, right? And so as we heal ourselves, we then want to bring that information to other people so that they can become empowered and heal themselves too. And it's like this ripple effect.
It sounds so therapeutic at the same time. It's like therapy and medical, body treatment at the same time, which is phenomenal. I love it. And so, who are the type of candidates for naturopathic medicine, or who are the types of people that you see? Are these people who, for whatever reason, have not gotten the care that they desire from like the conventional hospital setting, clinic setting, or is it perhaps someone who has allergies to conventional medications and so they want to do an all naturopathic? Is it preference, or is it by need, or both?
I think it's both. And then sometimes too, it's by acuity level, because we have patients who literally all around the globe, from all walks of life, all ages, all identities, people from all over the world who have varying aspects, like they have ideas of how they want to manage their health. And I would say that the people who seek out naturopathic medicine are either people who, out of the gate, before they even really get very integrated into the conventional medical model as patients or as forever patients, it's like they've known from the get-go that they're really into prevention, and they want to take a more natural approach. And those people will wind up seeking out naturopathic care. But other people find us when they become kind of disenfranchised or disillusioned, disengaged with the conventional medical model. Maybe they feel like they feel a little invalidated, like they haven't been heard, that there's not really time for them, that the system doesn't really care about them personally. And I do think that in order to inspire change, we have to we do have to connect with people on a personal level, and we have to uncover their motivations for change. And then, make sure that we're structuring a treatment plan around what the person wants for themselves and what's going to work for their own life. I guess aside from that, other patients who find us, sometimes they're people they've been through the ringer in life, sometimes like personal life, but also in medicine. Maybe they've been under the care in conventional medicine. They have a whole healthcare team, but they're maybe not getting the results that they want to get, or they just are struggling with pill burden, or they don't really understand why they're taking the medications that they're taking and what those could be doing for them. And so it's like they need adjunctive care to help them understand why that's beneficial. And then maybe they're looking for a plan with naturopathic medicine, even if possible, when it makes sense, that they could bridge from what they're doing now to what they'd like to be doing. And so I think that the naturopathic model is a lot more in line with what people maybe want to be doing for their health, but maybe things have gotten too far gone. And then I know that there are some patients also who are struggling with some of the chronic diseases of modernity that we don't have a lot of answers for in conventional medicine at this point, like chronic fatigue syndrome, fibromyalgia, multiple chemical sensitivity. And even transgender medicine, thankfully that's growing and it's becoming more norm. And it's like, I have this vision where it's like a lot of these things would be under the umbrella of primary care. It's like, if we really zoom out and think of holistic, comprehensive primary care that's keeping up with the times and understands like how complex and dynamic the human organism is, and our relationships to nature and how much we need nature. Like, I think then that the naturopathic model makes sense to integrate it into the conventional model. And so anyway, some of these patients, they'll come and it's like they just don't know what to do with themselves. They are like out of hope and they're suffering. I think though that we sometimes underestimate how therapeutic it can be to just be heard and to have someone acknowledge, like, it's really validating to have someone acknowledge, like, I hear that you have been suffering and I know that you want to feel better. I don't know how we're going to get there yet. I am willing to partner with you to find out though. And we're going to figure it out together. It's going to be like a quest, and that path is different for everybody. And so that's where I think naturopathic medicine shines too.
As you're talking, I'm so reminded of my father-in-law and his journey over the past couple of years. He and my mother-in-law, they live in Denver, but they were in isolation, obviously. They were 83 at the time. They were in isolation for a couple years. And throughout that, let's say, year and a half, his health drastically changed. He was dealing with this constant, what I feel like is a postnasal drip. It was going and nothing that any doctor could do. And he even went through the ablation? I mean, just so many things. And then he couldn't sleep. I don't know if that was due to stress. And so that he was sleeping 3-4 hours a night for months and months. And then he started forgetting. People close to him, like my mother-in-law, started realizing that. And he then was shortly thereafter diagnosed with Alzheimer's. And so just a series of things, like a domino effect of things happened throughout that year. And so, he has a pacemaker, just so many things are impacted. And of course, my husband's frustration was through the roof because not any single doctor could actually say holistically what's going on with my father. They could only talk about one thing at a time. So what Rob, my husband, did was he just took it under his own control. He set appointments with every single specialist and doctor that my father-in-law was seeing. And ultimately, the number one thing he tried to attack first was sleep. And so he got a sleep mattress. He checked his Apple Watch for his sleep duration and the REM sleep and deep sleep. And so as his sleep naturally progressed, the other symptoms, if you will, alleviated. They're not completely gone, but his memory is so much better than it was before. And it's so funny, like he takes natural supplements, like we prioritize that. We go down the aisles of a Lazy Acre or Bristol Farms here in LA, and we find the dandelion this and we just read about what helps with quality sleep, and like that's our main focus, and it's impacting everything that's going on. So I feel like I've lived this journey of what you are all about, not even having known that there are actual specialists out there for it. So it's so amazing. I just want everyone to know more about it, because genuinely people need this. You are genuinely like a health advocate for the whole person. So it's brilliant. I love it.
Yeah, and that's so funny to hear this story about sleep because, it's like it's a foundational thing. So in naturopathic medicine, we say that there are foundations of health. There are some things that we just cannot live without. And we seem to understand these concepts better sometimes, even like for our pets or for like even for our cars. It's like, oh, my car needs maintenance. I got to take it in for its tune-up, its oil change, the tire rotation, this and that. And we totally forget about ourselves, that we are like this organism that also needs maintenance. And so it's like, we take our dog out for a walk, but do we take ourselves out for a walk? It's like these things that we do for our pets, even it's something we don't do for ourselves. Or it's like, the cats are napping 16 hours a day or whatever it is they're doing. And it's like, but we're running on fumes. And so the foundations of health are absolutely critical. If we zoom way back out in kind of an evolutionary biology model, and we think of the human being as an animal living in nature with all these other animals around us, it's like, what does the human mammal need to thrive? And there are certain foundations. Sleep is one of them. It affects really everything. And so we often tell people, they come to us and they're like, oh, I'm having brain fog. I don't feel as sharp as I was. Oh, I'm gaining weight and my blood pressure's high and I'd like to get off my blood pressure meds. And it's like, how's your sleep? Because, for a lot of these people, they have undiagnosed obstructive sleep apnea. They're having initiation or maintenance insomnia. They're having nocturia where they're having to urinate in the middle of the night several times and having difficulty getting back to sleep. And sleep is something that is so foundational to our health that, we all feel it if we've had a bad night's sleep, and we know that it impacts performance. So if we imagine that just growing and being a chronic issue that goes on long, like what would happen if we knew that our car was like getting, low on gas, and then we just kept driving and driving and driving, eventually we're going to run out of gas. Like when we have this kind of thing, oh, I'm running on fumes, but we actually fail to really take that seriously and know what we need to do to restore ourselves and replenish. And it's kind of, I would say, naturopathic medicine in terms of prioritizing the foundations of health, which would be like sleep, nutrition, movement, even financial health, sexual health, our interpersonal relationships, having our life that feels meaningful, that we have purpose, so that we want to live. All of these things are really important. It's just a part of the puzzle. And so
when you talk about weight management, that's something we've talked, of course, a lot about in this series. I mean, I feel like, isn't it arguably fair to say everybody's first approach to weight management is a naturopathic form, which is nutrition, like trying to eat better, whether it's caloric or, nutrient based, or exercising, whether it's for fun or a chore, like kind of is for me, but they're doing it so that they're trying it. They're the natural remedies first. And if they hit a roadblock or they plateau really quickly and they feel like I need some intervention, I need professional assistance to get me through this, what is your first approach to it? What do you look at? What do you ask them?
So I actually designed a little weight management intake questionnaire so that I can get kind of a feel for them. I want to know their story. Like, how did you get to here? This whatever struggle you're having with your weight, whether it's that you just want to make healthier food choices, or like maybe it's even someone who's at normal weight, but who's having like high blood pressure or high cholesterol or something, and they'd like to optimize their health. So I try to figure out like what their motivation is and how they got to here, and then also where they'd like to go. A bit more about the history there, and like what their diet looks like now, so that I can tailor the approach that I'm going to take to that patient. So I would just say that there are as many approaches as there are patients, and so it really just comes down to working together. The main thing I would want people to know, though, is that if they want to prioritize, if they're concerned about their weight and or like say their diet or anything else that could be tangentially associated with weight, and there are lots of things that can be, then it does help, I think, to seek out professional help just so that there's guidance even. And it's not even so much that we have to be taking a medical approach to that so much. I think that where I like the naturopathic model is that at times it's like maybe we're just going to be a health coach for you, essentially. It's like, how do we create accountability and how do we come up with a plan? How do we structure a plan together? It's, so I like to try to bring, I think of naturopaths as being facilitators, never gatekeepers to the medical system or to health. So it's like when someone comes in and they say what their goals are, it's like I want to find out a way to work with them so that I can make sure that I bring my education and experience and all the resources that I have to bear to connect them with the help that will that they could benefit from based on what they're telling me they value for their life and they want with their goals. And that's a little different for everyone.
That's just amazing. I love what you talk about in terms of overall the patient being the center of the system of care that you look at and its role in today's modern medicine. There is, I think that, on the hospital side, we focus so much on pathology and disease that we forget about just the basics and how important it is, and having someone on your side that will listen to you in that way. So toward that effect, we all know that stress plays a critical role in maintaining a healthy you. What naturopathic approaches do you recommend in addressing this?
Okay, stress. I think naturopathic approaches to stress, I think, come back to looking at the whole person. What is the cause of stress? So the naturopathic model wants to look at the root cause. And this is how we're a little bit different, too, than the conventional model. I do think, though, that all healers are looking for the root cause when they can find it. It's just not always discoverable. If the root cause is not discoverable, then we're left treating the symptoms as best we can. It's like, okay, well, and even when someone says they're stressed, it's like, well, can they describe what they're experiencing? Like, how do you know that you're stressed? Or like, what is it that you experience that you're calling stress? And so that I can try to understand more about where they're coming from. For all I know, maybe they're just having a bit of low blood sugar and they're suddenly feeling really stressed and anxious. Or maybe they have, maybe there's something very specific that has them feeling anxious or worried about something that I want to focus on. But so I'd say trying to get to the root cause through an interview, through getting to know the person, and this is where it's like, I think conventional medicine maybe just doesn't have the time and has kind of given up on this. It's like, we want to know who you are, actually. Like if a friend, and I like to treat all of our patients as friends or family members. And I know that that's totally, conventional medicine would just like cringe. I can just see people right now being like, oh my gosh, this is not a good approach. The reason I'm going to advocate that it is because what do we do? People say, well, oh, you can't be objective, if you get too irrational if it's someone that you really care about. Yeah, sometimes that can be true. And so it's good to have like a third party weigh in to get additional options. But also, what do we do when it's someone we love and there's something wrong? We go the extra mile. We dig in and we do our research, we do our homework, we try to help them, we try to bring all the resources we can. It's like it takes a village. If one person in our community is sick or needs something, then the rest of us want to rally around that person to bring them what they need. And so, I think actually what treating each person as like how I would want friends or family of mine to be approached, it makes me go the extra mile for them. It's like, I can't really help you if I don't get to know you. So it's like, I want to get to know you so that I know what you value. And then like, what's going to work with your life? If a friend comes to me and they're struggling with stress or this or that, then it's like, well, what's going on and how do I support you? And figuring, and also kind of returning to some degree, listening, because there can be a lot in just being heard. There's a therapeutic value in being heard, but then also, how do I still return, knowing what I know about this person, how do I return that locus of control to them? Like, what's worked for you in the past? Has this happened before? And how have you dealt with it then? And, trying to troubleshoot the situation, involve the patient in that decision making. I think that's how we get the buy-in and really help them help themselves.
I love how you use the term healers to kind of talk about all
Mm.
caregivers and healthcare professionals.
Yeah.
Professionals, I love it. And you also hit upon something that I've heard Eugene talk a lot about, which is I think what makes him an amazing doctor, which is patients don't care about what you know until they know that you
Yeah.
care. And it seems like that is just the foundation of
Yes.
naturopathic medicine, or at least for you. So it's
Yes.
so meaningful. I just love that.
I think that's the approach we really take at the Lavender Clinic too. And this is why the Lavender Clinic is special. I know a lot of people haven't heard about it. It's a nonprofit here in Honolulu, a fledgling nonprofit, by the way, and it is the end of year. So I am going to have to give a shameless plug for fundraising. We need donors all the time. And so it's like, if this message is appealing to you, if this is resonating and you think this sounds neat, I like this approach, and I'd like to, the ways that people can support us, it's like, please think about being a patient if you live here, if you live in Hawaii. We can see anyone, in the state of Hawaii. Otherwise, if you can't become a patient yourself, but you think you're supportive of this cause or this movement or the way that we're approaching healthcare, so there's just a huge opportunity in Hawaii to advance, to integrate naturopathic care and to expand the healthcare in Hawaii to make it from healthcare to holistic healthcare. And I think by doing that too, we also create some space for indigenous medicine, indigenous wisdom to get woven back into the healthcare system. And that could make Hawaii really special because the islands have like their own kind of mystery and their own, their own gifts to reveal that we could be benefiting from if we could harness some of that and put it in there.
You mentioned that the Lavender Clinic is a very, it's an inclusive healthcare center, particularly
Yeah.
as it pertains to the LGBTQ community. Why did the clinic and the founders of the clinic or the foundation find that that is a community that needed more special attention or care that they weren't given in any other healthcare setting? Talk to us about that mission.
I'm of the mind that gender affirming care belongs under the healthcare, under the umbrella of primary care. And that if we're doing really robust, comprehensive primary care, then gender affirming care is just one service of that. As far as I know, though, I think that the movement has gotten a lot more attention in recent years, and more people are becoming aware of the LGBTQ community and the unique needs that they have. When this clinic was first started, from my understanding, there really wasn't anywhere else in the islands that was serving this population. And so there were no clinicians that were really trained to treat them and this specialty and to offer them what they needed. And so you have people trying to like kind of cobble together the care themselves. Or ordering things online, maybe on the dark web or something, and then doing like home injections and stuff. And so this clinic is, I would describe it as a clinic that has been created by the people and serves for like by the people and for the people. And what I mean by that is not just patients, but also staff. It's like, I would say it's heart work. It's in heart, as in like heart centered work. This is the kind of thing where it's like, it's a passion project. We all work there because we believe in the mission and we want people to have access to this kind of care. So I think the Lavender Clinic is unique in that they were the first to bring gender affirming care to the islands. And I think they might be one of the only ones doing even some of the youth gender affirming care at this point, which is kind of harder to get, that they took a chance on hiring a naturopath and they want to continue to blaze the trail and change how primary care is done in Hawaii, like starting at the Lavender Clinic by making it more robust and holistic like this. I think, in some ways I think of it as like the Rainbow Clinic with a rainbow bring like an umbrella. And it's like everything under the rainbow is something that should be offered in really robust primary care. And then you find lots of little pots of gold, right? Like when the patient meets some of their goals and they get the things that they're looking for in their lives, it's like, that's a pot of gold. There's just all these little pots of gold waiting to be discovered. And they're like joy for each of us. It's like, oh, there's goodies in here. It's like every day is Christmas. When you get to do work that is meaningful and the patients are getting the results that they want to see, like that's reward in and of itself. Those are the pots of gold. And so I think that the Lavender Clinic is doing unique things and that there's a lot of room for it to do even greater things and even role model to some degree how a model like this could work in healthcare.
Well said, and I'm so glad they did take a chance on you. And
Yeah.
you now lead their obesity clinic. And so I was curious, we got acquainted with you over a webinar over a GLP-1 medication, which we've talked about in a previous episode.
Yeah.
So how do you work within that setting? You don't prescribe, or at least on your own, or even as a first path, prescribe sort of weight loss medication. But, why were you on that call? Sort of what's your interest in that area?
Yeah. Well, so when I was in naturopathic school, became interested in overweight and obesity as a chronic progressive medical condition, and it seemed to me that it's still not the medical system in general, and insurance systems also are not taking this seriously. And the way we can tell that the insurance systems and the medical community is not taking overweight and obesity, they're not treating it as the chronic progressive medical condition it was redefined to be in 2013 by the American Medical Association. The reason we know that is because anti-obesity medications are not covered by most insurance plans. And if we thought that overweight and obesity was a medical condition, these medications would be covered, like antihypertensives are covered, and cholesterol medications and antidepressants are covered. And so there is room to be had, a lot of room for improvement within the medical model to recognize this as the medical condition that it is. And any chronic progressive medical condition requires management. And this is going to be lifelong management. This is not a fad diet. It's not a crash diet. It's not, like try to get someone to lose as much weight as fast as possible and then turn them back loose into their life. This would be like if someone came in and had really high blood pressure, we put them on a blood pressure medication, and then their blood pressure normalizes. And also we say, oh, and do the DASH diet, decrease your sodium, start exercising more, get better sleep, all these things. And it's like, of course, those things go hand in hand with that, or they're always a part of the treatment recommendation for any chronic condition. Diet and lifestyle and behavioral things are always a part of the treatment recommendations. It's just that that's not enough for a lot of people. And so they do wind up requiring medication. So if we normalize their blood pressure and then we send them out into the world and then we withdraw the antihypertensive agent, we expect them to become hypertensive again. Their blood pressure will go up. And so it's the same with weight. I think, it's like we can help coach people through that and we can prescribe medication to help there. If we achieve a therapeutic result, which would be defined as being more than 5% total body weight lost in 3 months, that is like a successful intervention. And then we withdraw that medication, then we can be pretty rest assured. And the research shows us that most people gain the weight back. It's like 95% gain the weight back within the first year, but almost everybody within 5 years. And so I think we have to really look at this as just one more thing that we would be managing over the lifespan. And even if once we have someone maintained on a weight, then we would, the weight that is working for them. And it's more about just the number on the scale. And it's more about how they look. It's about how they feel in their skin. There haven't been good answers for the weight management portion of medicine for a lot of people since these new GLP-1 agonists came on board or became available. This is like a new era, and it's the best thing to happen to obesity medication or to obesity medicine since bariatric surgery. And I'm going to go out on a limb and say it's better than bariatric surgery. Yeah, because people are getting similar results to bariatric surgery without the surgery. And so we always want to, and the bariatric surgeons have filled a really important role when there was like really nothing else that anyone could do. They came up with something to like manage people who were suffering with more severe weight problems. And they came up with treatment and they've been managing this for us. But I think that at this point, medications are getting good enough finally, which is so amazing. I'm so happy for people that these medications are available. And I think we just need to make it our job to bring them to everyone who could benefit from them and who's interested in that path. And then in my mind too, bariatric surgery and these kinds of medications are not mutually exclusive, because we have 2 people in our weight management program who have had bariatric surgery and they have regained the weight, right? That's not the panacea we want it to be. It doesn't work for everyone in the long run. It's also people have a difficult time sustaining that result. And so if we can get people, managed with these medications, then maybe even, they have the surgery, but when they start regaining weight, this is what I mean by we need to have a lifetime relationship with them. What I love about primary care and naturopathic care is that we would get to be the point person to manage someone's whole person health from across the lifespan, from childhood to older age. We would be their primary point person and then connecting them with the rest of the healthcare system and the options that could help them. For the reasons for that vary, but it's thought that there's still a lot of stigma associated with with overweight and obesity, and that we're still thinking of this as a character flaw by people, that it's some sort of moral failing. We just really have to recognize that this is a medical condition that requires medical management. And like everything else that we manage medically, we at the Lavender Clinic, and myself, and I would say in naturopathic medicine, I hope, is that we want to put the patient front and center with that. What does the patient want? And the right plan is the one that works for the patient.
Yeah, I couldn't agree more. I think that the GLP medications are going to be a new frontier, and everything that you're talking about and how traditional medicine frames obesity and how it's incorrect, and that we need to put the patient first. And I just think it's going to be a new era in this regard, because obesity is linked to so many chronic conditions. It's linked to cancer. It's linked to over 40 chronic conditions. And then when you start taking care of the obesity, there's so many other chronic conditions that, just by losing 5-10%, you can take care of so many other conditions along with it. Polycystic ovarian syndrome, non-alcoholic steatohepatitis, NASH, even hypertension, hyperlipidemia, obstructive sleep apnea. The list goes on and on and on.
Which is why it's mind-boggling that, primary care physicians don't leverage it more, and that insurance providers aren't covering the weight loss medication when it in and of itself could alleviate a lot of the other costs of all the other medications that come downstream of all the chronic conditions that Eugene just mentioned. So it's so mind-boggling. And that's where I feel like the system fails us. You know what I mean? So like the more we can get this kind of education out there to the public who just would never know otherwise, right? That's half the battle.
Economically, it could help the healthcare system so much if we manage overweight and obesity better, because there are so many weight related comorbidities that come with it that are so expensive. And one of the main ones that is so devastating for people is diabetes, And so what we're finding is that in order to manage people's weight, we wind up having, if they're diabetic as well, then we have to manage the diabetes really well too. But yeah, I love that. It's like, to me, I've taken some heat, even within the practice a little bit, I will admit. It's like, what kind of naturopath are you? You're prescribing medications for weight loss. I thought that you'd be, prescribing herbs and tinctures and maybe unicorn tears. I think some people are expecting. But, it's like, I think this is the quintessential art of naturopathic medicine. This is getting to the root cause. This is understanding that overweight and obesity are medical conditions and that there is treatment available to help them. And also, I do take we take a holistic approach where it's like, we screen people for disordered eating too. And I think a lot of conventional models, they screen people for disordered eating, and they use that to screen people out of programs for weight management because, you have an eating disorder, we're not going to touch that. It's like a hot potato. Everybody wants to drop it, refer to behavioral health. They don't want to help someone with their weight. And I think that that's really, I think that that's, it's well intended but misguided. And so I think actually a better approach would be to say, like, why is this eating disorder here? Like, we have to really get curious about that. And this is that motivational interviewing piece and like establishing rapport with our patients and getting to know them. Like, what is this doing for you? Or what are you trying to control with this? And we have to find out the motivations for that. And then what I'm finding is that for a lot of people, if they have medical help achieving, so long as the goals they have for themselves are healthy, and I would say 99% plus of the patients that we see, their goals are healthy for themselves. If they have medical coaching and medical management to get to what they're wanting for themselves, it could be done in a healthful way. And we don't have to say, oh, this is something that's in your head. Like, I think it's actually strange in some ways that like anorexia, bulimia, binge eating disorder, night eating syndrome, a lot of these are like in the DSM, the Diagnostic and Statistical Manual for Mental Health Disorders. It's like these are physical conditions too. And then that mind-body connection comes into play. And so I think that it is absolutely essentially naturopathic medicine that we want to get to the root cause of what is going on for someone, and then also manage, because if we get to the root cause, then we automatically head off all of those weight related comorbidities, the downstream effects of those, and we're really treating upstream. So I think we have to go as far upstream as we can. And the other thing that I like to screen people for when they come into the practice is any conditions that we know could be contributing to or causing the overweight or the obesity, like chronic stress, like obstructive sleep apnea, like insufficient sleep, or maybe even just poor sleep hygiene. And people aren't aware that, like, if they would, we prioritize work and productivity so much, and then we fail to recognize that, like, oh, if we only sleep 6 hours a night, it has all these health consequences. And one of them is that it causes weight gain. And so we like to screen for all of that and see, like, I like to think of weight as being in the center of a Venn diagram or something. And it's like, what are all of the confluence of influences that are factoring into causing overweight and obesity, and then from there, what are the all of the weight related comorbidities that come from it, And so then we have to like backtrack and like get back. I will just say for the GLP-1 agonists that they are natural. This is a natural hormone that exists in the body already. So yes, it's been and this, so people are looking for natural solutions. It's like, this is wonderful. And, sometimes people think natural means safe. And they conflate natural with safe at times. So it's like, Botox is natural too. And that can kill someone, or we can purify it and use it very strategically in medicine to achieve our outcomes, like the results that we desire. And I think that we can do that for all sorts of things, or even like supplements. People are willing to take a supplement for something. There are no supplement trees in nature. At that point, we've got the product so, we have that herb or, whatever the substance is, we have it so removed from its natural setting, and then we're processing it and refining it. It's there's very little that's different about it at that point than a prescription medication. And I think it's important to remember that a lot of our prescription medications, like statins and like some of our antiarrhythmic drugs, they do come from plants. And so like we can't forget that pretty much all medicine comes from nature anyway. It's just a matter of how purified it is and how strategically we're using it for people. So to me, these naturopathic medicine and conventional medicine are not like opposed or at these opposite things, or even have really different philosophies. Both fields are looking to try to get to the root cause and help people, and both of us are using all of the tools available to our resources, like all of the available resources as tools to help the problem.
I mean, even aspirin is from the bark of the willow tree, apparently. So,
Yeah.
that was just an amazing unpacking of everything. And we've just learned so much from you, Dr. Keith. You're just such an inspiration, and we really appreciate you coming on the show today,
Thanks.
giving us everything in terms of the background for naturopathic medicine. You're such an inspiration with the Lavender Clinic, and we were just so glad to have you on the show.
Thank you. Well, I'd be remiss if I didn't give a shout out to all of the patients there who keep the clinic going. People do have a choice as to where they go for their health care, and we're really grateful that people choose us and give us a chance. We might not be like the fanciest place in town, but we have a lot of heart, and you know that we care when you come there.
Thanks for tuning in to The House Call. Make sure to like and subscribe so you don't miss out on our weekly episodes. And if there's an important health topic you want to hear more about, let us know in the comments and we'll make The House Call. Till then, take care.